Hello, this is Dr. Roger Sirek. I'm here with my daughter Evelyn. She is 3 weeks old, and today we're going to be going through a little bit of an adjustment. So I'd like to tell you a little bit about what I'm doing and what she's feeling and how much pressure I'm using, just for anybody who's concerned about having their baby adjusted. Now the first thing I'm going to do is lay Evelyn down, and I have a nice little mat, nice and soft plush frog that kids like here. So first what I'm going to do is, while Evelyn's laying here, I'm going to motion through some cervical motion and feel the vertebrae in her neck. And I'm just using light touch. I'm usually using my pinkies because my fingertips on the other fingers are too broad and too wide to feel very well. So as we turn her head, I'm just looking for her head to move well. I'm looking for her to be comfortable with the way her head turns, and I'm just kind of following her motion, letting her decide where she's going, and I'm just helping her along. And then as I feel something, if I feel a little bit of motion restriction in the vertebrae, what I do is I hold that vertebrae just with my pinky again, and it's a real light pressure. And here she's turned her head away. There we go. I want her head off to her right, and then I just hold pressure there. And sometimes I'll do a little vibration and just help put that vertebrae back into place. And I'll hold for anywhere from 30 seconds to 1.5 minutes, depending on if I feel it go in. So, fairly painless. Sometimes they'll squawk a little bit if it's a sore spot. Usually they don't mind it at all. Then what we like to do is, for low back adjustments, lumbar type adjustments, what I like to do is I actually like to lay them on their stomach, right across my knees here. And similar to the neck, take your nook there, dear. What I'll do is I'll feel through the vertebrae, and what I'm able to do is kind of motion the vertebrae as she's on my knees. And what I do is I find another spot that I want to adjust, and I just hold pressure again. Sometimes I'll push her butt and her hips down, and just creating some extension, almost like a Gonstead knee chest table. And she's fairly comfortable here, so I again just hold pressure. Sometimes I'll do a vibration while holding there, and again I just hold anywhere from 30 seconds to 1.5 minutes, just trying to feel that vertebrae kind of move or slip in. And for the most part, this is fairly comfortable for them. And lastly, with the thoracic adjustment, I'm sorry. I know you're sleepy now. Either mom or dad can hold them, and you can adjust while mom and dad are holding the baby, or I can hold her myself and do the thoracic adjustment. Again, same thing. Feeling the vertebrae, feeling the spinous processes. Sometimes I'll do some muscle work depending on what I find, or again, just holding that vertebrae on either side. And I'm not going to show you that now. She's getting ready to be done, but just again, holding the vertebrae and just vibrating. So thanks for watching the video. If you're ever interested in having your child adjusted or learning more about it, please feel free to give us a call.